Hi everyone, this is Danielle. I'm going to be doing the neuro exam. We're going to pan around the room real quick. I'm going to show just a few things I have. We're going to get started. Okay, with any exam, you're going to introduce yourself to your patient. Hi, I'm Danielle, I'm your nurse practitioner, and hand hygiene. So I've got some hand sanitizer here. We're going to do that. Okay, for the first one, it's going to be cranial nerve 1. That's going to be your olfactory or smell. I'm going to check nasal patency on my patient. When I'm going to breathe in on both sides. Perfect, they're patent. Then I'm going to have him close his eyes. I'm going to take a familiar smell, close the nostril, have him smell, tell me what it is.
Coffee.
And then on the other one, tell me what it is.
Coffee.
Very good, his smell is intact. We're going to move on to cranial nerve 2, which is the optic. For this one, we're going to be doing the Snellen test. I've printed off a Snellen chart. I'm going to have him hold it a reading distance and cover his eye with a piece of cardboard. If you'll just cover it. And then I want to, for sake of time, I'm going to have him just read the last line, or the line above the red. If you'll read that with your left eye.
D-E-F-P-O-T-E-C.
Perfect. Switch eyes.
D-E-F-P-O-T-E-C.
Perfect. So per the Snellen, he's got good visual acuity and his vision is 20/20. We're going to do the visual field. So for this one, I've seen this done a couple different ways, but we're going to do the 4-quadrant visual field test. So we're both going to cover the same eye, and then I'm going to hold up a hand with numbers and have them tell me what it is. All right. And you just tell me when you see it or what number. Okay, ready?
1. 1. 1. 1.
Okay, we're going to switch. Okay, ready?
1.
Perfect.
1. 1. 1.
Okay, perfect. I've also seen with this test where they have you kind of come behind and have the patient say now when they can see your hand.
Now. Now.
I don't know if you can get it.
Now.
Okay.
Now. Now. Now.
Okay, perfect. So visual fields are intact for that one. Moving on to cranial nerve 3, 4, and 6. You've got your ocular motor, you've got your trochlear, and your abducens. For this, we're going to be using a pen light. I'm going to be checking to make sure the pupils are equal, round, reactive to light, and that the concentric pupil also constricts to light. So real quickly, shining a bright light. Okay, on both sides, pupils are equal, round, reactive to light. I'm going to look at the opposite pupil whenever I shine light in like the right one. We're going to be looking at the left one. Okay, and it constricts. And then same on that. So I'll shine the bright light in the left, and the right pupil is constricting. So sorry. So pupils are equal, round, reactive, and the concentric pupil constricts to light. So we're good there. We're going to move on to the H pattern test. This checks the 6 cardinal fields. Some people like the star. We're going to do the H. We're going to be checking for extraocular movements. If you'll just follow my finger, we're going to do the H, H, H. Perfect. The eye movements, there's no signs of any nystagmus. It's smooth and intact. Moving on, we're going to be checking for accommodation and convergence. The easiest way I've seen this is where you take pen light or something and you have the patient follow it down to their nose. The pupils should get constrict as the object gets smaller, and the eyes should converge towards the object. So that is intact as well. Pupils are constricting equally. And that is all for 3, 4, and 6. I'm so sorry if you can't see me. We're going to move on to cranial nerve 5. Cranial nerve 5 is the trigeminal. For this one, we're going to be checking the temporalis and masseter muscles. We're first going to, can you see me? I feel like I can't see my head. I'm going to have the patient, I'm going to ask him to bite, and I'm just checking to make sure that the strength is equal and intact bilaterally, which it is, and he's biting, so we're good there. Second part of this is going to be getting cotton ball, cotton whisks. We're going to be checking for soft or light touch, make sure that sensation is intact. So for this, I'm going to have him close his eyes, and I'm going to touch his chin, cheek, forehead, and he's going to tell me now. So if you'll do that.
No. 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 No.
Okay, so light sensation is intact. And then we're going to also be doing dull and sharp. So I've got a little sharp. Can't probably see it too well on there. But same thing, eyes closed. If you'll just tell me when you feel it.
No. 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 No.
And that was sharp, and we'll do it with dull.
No. 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 No.
Okay, so dull and sharp sensation is intact. And then the last one for that is you would actually take your cotton. We're going to be checking the corneal reflexes. And I'm not going to actually do this, but I'm going to be touching the patient's eyes, and it should elicit a blink on both eyes. And did I do that? Okay, perfect. So that was your trigeminal. Next one is going to be facial. You might want to, can we move in just a little bit?
Yeah.
So for facial, we're going to be, and this is cranial nerve 7. What I'm going to have him do is a couple things. I'm going to have him smile. I'm going to have him frown. I'm going to have him show his teeth. I'm going to have him raise his eyebrows. And then I want you to close your eyes and then relax them. Try to open them. Good. Then I want you to puff your cheeks. I want you to try to push against me. Okay. And basically what we're looking for is make sure strength is equal bilaterally and it's symmetrical, which his is. Okay. Moving on to after facial is 8, cranial nerve 8, which is vestibulocochlear or auditory. This is going to be the hearing one. For the sake of this video, there's going to be just 3 tests that we do. We're going to be doing the whisper test. We're going to make sure that his hearing is intact. So we would do the whisper test. He can hear on both sides. Hearing's intact. And then we're going to be doing the Weber and the Rhine test, which will have the tuning fork for both of those. Weber, you know, would be the one on top. Make sure that he can hear equally bilaterally on both sides and that it's intact. And then with the Rhine, we're going to be just making sure that your air conduction is greater than your bone conduction. So that is cranial nerve 8. We're going to be moving on to 9 and 10. This is going to be your glossopharyngeal and vagus. So for this one, glossopharyngeal, you're going to make sure your swallows, ask your patient to swallow, make sure that there's good movement, no difficulty swallowing, which give me a swallow, looks good. And then we're going to look at the uvula. Use your tongue blade, have them stick out the tongue, and you're going to put your tongue blade down, have them say, ah. Uvula should rise midline, excuse me. And then you're going to also elicit a gag reflex. I'm not going to do it on him, but you're going to use the end of the tongue blade and go towards the pharynx. And that should be it for that one, 9 and 10. Moving on to 11, which is your spinal accessory. Spinal accessory, you're going to be going against my resistance. So for this one, I'm going to be using my hand on his face. I'm going to have him push against it. And same thing on the other side, push against it. And then shrug your shoulders. And it should be equal, bilateral. Strength should be good on both sides, which his is. And that is all for the spinal accessory. And then for 12, that is your hypoglossal. This is going to be all about the tongue. You're going to have your patient stick out their tongue. And you're going to ask them to protrude it, make sure it's midline and that the movements are equal, or that there's no difficulty moving the tongue. Looks good. That should be it for the tongue. And then the last part of that one is to check strength equally bilaterally with the tongue. So what you're going to have them do is stick the tongue towards the cheek and you push against it. And should be good there. So that is the 12 cranial nerves. Now we're going to move on to cerebellar function. First one we're going to start with is having the patient walk on their tippy toes. I'm going to try to get a good angle. You're going to instruct your patient to walk on their tippy toes.
Just pick it up.
Okay. Gosh, I'm so sorry. Okay, if you'll walk on your tippy toes, and then you're gonna have your patient walk on their heels. And motions should be well coordinated, well balanced, symmetrical, no difficulty in this case. He did well. And then we're gonna do the Romberg test, where I'm gonna have him close his eyes, put his feet together. You can kind of guard him for safety, and for 20 seconds. And you wanna just make sure that balance is good, which it is. He's coordinated, good balance, and he's not swaying. Moving on to rapid alternative movements. You'll have your patient with their hands. You're going to have them slap their thighs, and with the front and the back of their hands. So if you'll slap back and forth. Perfect. And you can ask them to get faster. Perfect. Good. Should be rhythmic, equal. And then the last part of that one is, actually there's two more. I'm so sorry. You're going to have him do the finger nose. Sorry, you're getting dizzy. Finger nose. So I'm going to have you touch close your eyes, touch your nose and out. You're not looking at me. Make sure you know what I'm telling you. Yep. And both. And just make sure that those are equal as well. And then the next one is going to be your heel shin. And you're going to have them place their heel up the opposite leg, and it should move up in a straight line on both sides. Perfect. Good job. Okay, and then the last section is the reflexes. There's going to be 5 of them. And I've got my reflex hammer. Okay, so for the first one, we can just start. Let's do the biceps. So biceps, I'm gonna hold, let his arm rest in mine. Can you see that? And then I'm gonna take my hammer and strike my thumb. Okay, good job. Then we're gonna do the triceps. For the triceps, you won't really wanna have the patient kind of loosen your hand. You're gonna hit right a couple inches above the elbow. This one's a little bit hard. Oh, I got it that time. Okay, so that's intact. Both of those are +2 intact. And then we're gonna be doing the brachioradialis. You can hold their thumb and, well, you've got a watch, so let's do it on this one. Hold the thumb up and just a couple inches above the thumb or wrist. We're gonna get that. And then we're gonna do the patellar. This is kind of hard to do with this chair's not high enough, but
we can go right here.
Okay. And you're gonna just hit right below the knee. Okay, relax your leg. Okay, well, that was dramatic. Again. Okay, good.
That was
a good one. Okay, I don't know if you can see it. And then for the Achilles, you gotta show the back of the leg. Relax the foot and the hand, and perfect. And you're gonna hit the Achilles, and you're gonna elicit a dorsiflexion of the foot. Do it again. Hold on. Oh, that was a good one. Okay. I don't know if you can see that too well in there, but all of his reflexes are +2, and we're just doing one side, but they should be bilaterally equal. All right, and I think that's it. Thanks so much. Take care.